Namaste. This is Dr. Vinod here, and I hope you are doing well. Today I'm going to speak about a common problem that affects many of us, something called frozen shoulder. So what is frozen shoulder? Contrary to what the name might suggest, the shoulder does not become cold or frozen. It is called so because in this condition the shoulder becomes quite stiff, painful, with a decreased range of movements and function. Now this causes severe disability to the patient who suffers from this condition, and more so if it is on the dominant side. The old medical term for this is Peri-arthritis or Peri-arthritis, and it is also called by the other medical term, which is adhesive capsulitis. So what happens in this condition? Now, to understand this, we need to know a bit about the anatomy of the shoulder. Now, the shoulder consists of mainly three bones. You have the scapula or the shoulder blade, and then you have the humerus or the arm bone, and then you have the collarbone, which is in the front. Now, the shoulder is like a ball and socket. So you have the ball formed by the top end of your arm bone, and then you have the socket, which is formed by a part of the shoulder blade. And then what surrounds this is basically something called a capsule, which is a tissue, which is like a bag, which normally encompasses the shoulder joint, in which you have the normal lubricating fluid. So in frozen shoulder, what happens is this band contracts, the volume of the shoulder reduces, and there's also thickened scar tissue which forms in the band and inside the shoulder, which prevents the shoulder from moving. There is also a reduction in the amount of lubricating fluid inside the shoulder, and this results in the condition of frozen shoulder. So what are the symptoms of frozen shoulder? The two most important symptoms of frozen shoulder or adhesive capsulitis is 1, pain, and 2, stiffness. So the pain usually starts off as a dull ache, which is present most of the time, or it may come and go. And then it becomes more persistent and also increases in its severity and intensity. So it can be like a sharp stabbing pain, or it could be just a dull ache in the shoulder, all around the shoulder. Now the pain also sometimes involves the muscles which envelop the shoulder, and the pain can sometimes radiate down the arm up to the elbow, and in some people even up to the fingers from the shoulder. Second symptom is stiffness. So the stiffness usually is not much in the initial phases. In the initial phase, you usually have a lot of pain, and then you have pain and stiffness together, and then the pain usually subsides and the stiffness persists. Now the stiffness is in the beginning only in very small amounts, so only the extreme range of movements, like if you have to reach out to something, or if you have to reach behind your back, or reach out in the front to pick up something, then you might feel the stiffness in the extreme or the end range of the movement. But later on, the stiffness becomes more pronounced, and then it also affects the normal day-to-day use and functioning with the arm. So who gets frozen shoulder, and what are the risk factors for developing this condition? Often we don't have a particular reason for why people develop frozen shoulder, but very often it is seen that it is associated with certain medical problems or in certain groups of people. It's more common in women, and it's also common between the age groups of 40 to 60 years old, although it does happen in men too. Your risk might go up if you've had a small recent injury to your shoulder, or if you've had surgery around the chest or shoulder area, for example, in ladies who have had a breast surgery, or if you've had certain medical conditions like stroke, which results in lack of movement in the shoulder area or lack of movement in the arm. This increases the risk of getting a frozen shoulder. There are also certain medical conditions which can increase the risk of developing one. And one of them, or the most common one, is diabetes. It is said that about 10 to 20% of people who have diabetes suffer from some degree of shoulder stiffness or frozen shoulder. It can also happen in patients who have thyroid problems, in Parkinsonism, or in case of cardiac diseases. So does frozen shoulder settle on its own? What's the natural history? Now, in the books, it is mentioned that frozen shoulder is a self-limiting condition, and it's often believed to be so, which means that over time, eventually things will get better and it will subside completely. It is said that frozen shoulder patients regain full range of movement eventually, But what we have noticed in practice is that very often patients do recover, do improve with time, but they are eventually left with some degree of lack of movement and functional limitations and pain, which can come on and off. So once you get frozen shoulder, what are the treatment options? As with most conditions, initially to reduce the pain, one has to take analgesics or anti-inflammatories, painkillers, to reduce the inflammation and the pain around the shoulder. Once we've got a handle on this pain, then we have to think about moving the shoulder to try and get rid of the stiffness in the shoulder. And this can be done with initially home exercises or more aggressively and intensively with physiotherapy input and intervention. If this does not improve things or the pain is very severe, then the person can benefit from having a steroid injection into the shoulder, which can help to reduce the inflammation and the pain, as steroid is a strong anti-inflammatory. Now, once you hear the word steroid, you don't have to worry, because the dose that we inject into the shoulder is a very small dose and usually does not cause any other systemic effect in the body or long-term damage to the body. Then there is the option of having saline injected into the shoulder to try and expand the contracted capsule and increase the volume of the capsule, thus improving the range of movement of the shoulder. If this doesn't work, then the next step up is an intervention wherein we put the person to sleep with a small or a short general anesthetic, and then under the anesthesia we then tend to manipulate the shoulder to try and break the adhesions in the scar tissue, trying to improve the range of movement, and also do an injection in the same sitting so as to reduce the inflammation and the pain. Then of course there is surgical intervention which can be done. This is usually an arthroscopic or a keyhole procedure wherein we put a camera into the shoulder, have a look inside, and with a special instrument we tend to break away all the adhesions inside the shoulder, remove all the debris and the scar tissue, and thus free up the shoulder to improve the range of movement and to reduce the pain. Now, of course, these interventions doesn't have to be done in a stepwise manner. We, of course, have to start off with painkillers and physiotherapy and exercises initially. But depending upon the severity and the degree of functional limitation, we can go straight to manipulation or even surgery if the symptoms are very severe or if it's been there for quite some time. So I'm going to demonstrate to you some very simple exercises that can be done when you start developing frozen shoulder. These are easily done at home, and you'll have to keep persisting with these exercises to get good results. So for this exercise, you have to stand a couple of feet away from the wall, place your fingers on the wall, and then slide it to the side all the way up, and then you can repeat this exercise after bringing your hand down. Here what you have to do is to stand a couple of feet away from the wall, facing the wall, place your hand on the wall and then crawl your fingers up. And as you do so, you may even want to move closer to the wall, but if you can't, it's okay. Move as high as possible and then bring your fingers down on the wall and back to the side. You can repeat it a few times. The idea of doing this exercise is to rotate your body outwards. So you have to keep your hand against the edge of a door or a wall and then twist your body so that your chest faces away from your hand. You can start off by keeping your hand down by the side, or then once you get comfortable with that, you can even lift your arm up to about 90 degrees or so and then rotate the chest. When you do this, you tend to stretch the front of the shoulder. You have to take your arm up and then take your arm across your chest and use your good side to pull your elbows towards your chest. Hold that position for a few seconds and then bring it back down. Then you can repeat the same by lifting your arm up to the front, then across your chest, pull your elbow towards your chest, hold it for 5 to 10 seconds and then bring it back down again. For this exercise, you have to use a towel of some sort which is of enough length. You've got to take it behind your back, twist your wrist such that you hold the towel comfortably. Now if you have to stretch or rotate your left arm, for example, you have to lift the right arm up
and then use the right arm to pull the towel up so as to rotate the left elbow and the arm up, and this will help to rotate the shoulder internally. Initially you might not be able to lift the arm much, but then gradually over time, as you keep doing the exercises, it will improve.
So those were the simple exercises that you can easily do at home. Now remember that these are not the only exercises. There are a lot more exercises that one can do to try and improve the range of movement and to get a control on the pain. It is very important that you don't persist with these exercises only at home if you're not seeing much of progress. This is just to get you started. It is very important that you seek medical attention early on and also probably have a formal course of physiotherapy to try and improve your movements. So that brings us to the end of this video on frozen shoulder. I hope this video has been of use to you and you have learned some things and understood the concept of frozen shoulder and what you can do at home to try and improve the symptoms in the early stage. If you like this video, please do press the like button, share this video to people who might find it useful, and do press the subscribe button to remain subscribed and notified of further videos coming up in the near future. As always, keep fit, keep moving, and stay healthy. This is Dr. Vinod signing off. Namaste.
If you liked this video or found it useful, don't forget to like, share, and subscribe. And if you want to be notified of further videos coming up, please do press the bell icon which is next to the subscribe button.